Welcome to The Explainer. If you've just kicked off your clear aligner treatment, you know that excitement is super real. But let's be honest, so is that initial soreness. Today, we're going to break down exactly how to manage that discomfort so you can have a much smoother journey toward that amazing new smile. So you've popped in your very first tray, or maybe you just switched to a new one, and things are feeling a little tight, a little pressure, right? Well, let me just say right off the bat, that is totally 100% normal. In fact, believe it or not, that mild discomfort is actually a good thing. It's the very first sign that your aligners are doing exactly what they're supposed to do, and your teeth are starting to shift right on schedule. Okay, so let's get into the why of it all. Why do they ache? It's not just a random feeling, There's actually some pretty cool science happening right there in your mouth. What's happening is your aligners are putting this very gentle but very constant pressure on your teeth. And that pressure is the signal that tells your body, hey, it's time to move. It triggers this natural process where the bone and ligaments around your teeth adapt, letting them slowly and safely glide into their new, straighter spots. A perfect way to think about it is like that feeling you get in your muscles the day after a really good workout. It's a bit sore, sure, but it's because you're making progress. That ache means change is happening. Your teeth are on the move. And here's the best part. This feeling doesn't last long at all. Usually, the soreness is at its peak in that first 24 hours. Then, over the next day or two, it starts to fade away pretty quickly. By about day 7, you'll probably barely even notice it's there. And get this. When you compare clear aligners to old-school braces, research shows that aligners are actually about 25% less uncomfortable, especially in that first week. Makes sense, right? No sharp metal brackets or wires, just smooth, steady pressure. All right, this is a really, really important part. We have to learn the difference between that normal, productive pressure and actual pain, which could be a sign that something's not right. And trust me, they are not the same thing. This chart right here is your best friend. Normal pressure feels like a dull ache, a feeling of tightness. Your teeth might feel a little tender when you chew. But a warning sign is different. That's sharp, stabbing, or really severe pain. If it's so bad you can't eat, or if it just isn't getting better after a few days, that's when you know something else might be going on. Okay, so now that you know what to expect, let's talk about what you can actually do about it. It's time to build your own personal aligner comfort toolkit. These are things you can do right now to get some relief. First up, these are the strategies your orthodontist is going to swear by. That strict wear schedule, wearing them 20 to 22 hours a day, is huge. It keeps the pressure constant so your teeth adapt faster, which actually makes it less sore over time. And don't sleep on those chewies. Biting down on them helps the aligner fit perfectly, which can relieve that tight feeling almost instantly. And then we've got some super simple tricks you can do at home. A cold compress on your cheek? Classic for a reason. It really works to numb the area. For the first day or two with a new tray, just plan on eating softer foods like smoothies or soup. It makes a world of difference. And if one little edge of the aligner is poking you, you can gently smooth it with a nail file. Problem solved. So we know a little soreness is all part of the game. But it is also so important to listen to your body and know when it's time to stop guessing and just call a professional. So what are the clear signals? How do you know when what you're feeling isn't normal and that you should probably pick up the phone and get in touch with your orthodontist? All right, these are the red flags. If you're experiencing any of these, don't just wait it out. Severe pain that doesn't get better, gums that are swollen or bleeding, or an aligner that just doesn't seem to fit right, those are all reasons to call your provider. Just remember, your treatment is supervised by an orthodontist for a reason. Your safety and comfort are always number one. So now that you are fully equipped with all the tips and tricks to stay comfortable, let's just zoom out for a second. Let's remember the big picture, the whole reason you started on this journey. I want you to remember this. Every single moment of that mild, dull pressure is a productive step forward. It is literally the feeling of your smile transforming. That little bit of discomfort is temporary, but the healthy, confident smile you're building, that's going to last you a lifetime, and it is so, so worth it. So I'll leave you with this last thought to chew on. Thinking about all these strategies, what's the one tip you're definitely going to try with your next tray? Because when you empower yourself and take control of your own comfort, you're not just getting through the process, you're mastering it. And that is exactly how you get to that incredible new smile.